Good morning. Welcome everybody to our information session. Thank you for being here today. My name is Jenny Appleby and I will serve as moderator today. I'm with Covering Wisconsin and the Milwaukee Enrollment Network. So this session is on the reopening of Healthcare.gov. So coming right up on Monday, February 15th is the reopening. And so what we're going to do today is go through everything that we know at this point. So I should note, in case you're somebody who's going to be watching the recording, we're recording this today on February 12th, 2021. So everything we're sharing today is accurate as of this point, but as we know, policies and procedures are always subject to change. So going into the next slide, we will talk about a few of the logistics. So first of all, because it is a large group, we did mute all attendees. That's really just to cut down on any background noise throughout the session. So if you do have a question, please enter it in the chat box. We are recording this presentation, and so you will be able to see that probably by later this afternoon, and that's at Covering Wisconsin's YouTube channel. I will in just a moment put that in the chat box as well. And then also anybody who is attending live right now, I have your email address. If you're joining through the internet, if you're joining by phone, I don't have your email address, but after the presentation, everybody who joined today, I will send you a copy of these slides for your reference. And if you're watching the recording, you can always just go ahead and shoot me an email. There's my email address on the screen and I can get a copy of the slides to you. So I'm going to go ahead and start with Adam and let him introduce himself.
There, it didn't want to take me off mute. My name is Adam Vance Baker, and I'm the Navigator Program Manager with Covering Wisconsin. If you're an assister, you probably know me. Really excited to be doing kind of the first Q&A part about all the frequently asked questions today. And I'll turn it over to Stephanie.
Okay, good morning. My name is Stephanie Sievers, and I'm the Insurance Literacy and Communication Manager at Covering Wisconsin. And my team is responsible for putting out a lot of the promotions you see that come from Covering Wisconsin, including videos. Last open enrollment, we did a lot of TV and radio ads, and also Facebook, social media. I'll talk more about that and give you more details later.
Thank you. So as you can see on the screen, this is what this session will address for the next hour. I wanted to just mention that our presenters, they have been listening to webinars, attending meetings, reading memos, having conversations, trying to take all of that information that has come out about this reopening of Healthcare.gov. And we're hoping today our goal is to consolidate that all into this one place, into this one session. And so we hope that you leave today with just feeling prepared really for the reopening in the next 3 months ahead. All right, so go ahead, Adam.
Sure. Yeah. So this is a special enrollment period. So if you're an assister, you know that is generally 60 days after a qualifying life event, with some exceptions, that you have an opportunity to get other health insurance, typically after you've lost health insurance. This is different than that. It is categorized by CMS as a special enrollment period, but for all practical purposes, it is much broader than that. It is much more like an open enrollment period, and in some ways, it's actually better than an open enrollment period, and we'll talk about that in a little bit. Stephanie will talk more about the messaging related to that, because I think there is a lot of confusion in terms of how to regard that. I mean, even based on what I just said, there's, what works for consumers is different than what we would call it internally. But, we're one of any of the states that are served by Healthcare.gov are able to, will have consumers who are able to access the marketplace again, in basically any circumstance. But again, we'll talk about the details very shortly.
So the way that this first portion is going to go, which is primarily Adam, is that I will serve as the moderator, I'll read the question, and Adam will respond. I wanted to note that we do have 9 different slides that are the most common questions that we've been hearing in the past few weeks about this reopening. And so What I would ask is that if you have a question that's related to our current slide, this topic, please feel free and go ahead and enter your question into the chat. If your question is related to a different topic, if you could hold, because there's a very good chance that it is one of the 9 questions we have coming. So your answer, we may have an answer really soon for you. So I hope that's clear. We'll kind of just address one topic at a time. And then at the end, we absolutely will have an extra time for Q&A as well. All right, so starting right off, one of the big questions, Adam, is do people need to have had COVID-19 or a specific life event to qualify for this special enrollment period? And you'll hear us call it special enrollment period or SEP or SEP.
Yep, absolutely. So the answer to that question, which is a really good one, just for everybody's understanding on how this is going to work, is no. Unlike a normal special enrollment period, the normal life events we work with all year to get people in the marketplace, anybody who would normally be marketplace eligible, so not Medicare eligible, not having affordable employer-sponsored coverage, anybody who could get in basically during open enrollment can take advantage of this special enrollment period, even if they don't have coverage. Most other special enrollment periods throughout the year, you had to be losing coverage. They are basically going to trigger this for anybody who applies between February 15th and May 15th. And are we pausing to see if there are any questions on a specific slide, or are we just kind of going to roll, Jenny?
I think we can roll unless if I see something pop up, I'll bring it to your attention.
Okay, cool. I can't open the chat because it'll block the screen.
Okay. So question number 2 is about what we would call qualified health plans or QHPs. So these are the insurance companies that offer a plan on the marketplace. So will all qualified health plans currently on the marketplace, so those that we saw this past open enrollment and have plans here in 2021, are all of those QHPs also going to be offering their plans during this reopening?
A pretty straightforward one here. I understand where some of the confusion came around just because there are so many exceptions about this special enrollment period and the rules kind of propping it up. But any QHP, any health plan that is already on Healthcare.gov, that was on Healthcare.gov for open enrollment 8 going into 2021, will be on and will be available under the SEP. Everybody who is in the marketplace already has to participate. They're contractually obligated to participate. So any plan that you saw before, you will see, and people will be able to get on now.
Okay, thank you. Next question, pretty simple. What date will the coverage begin?
You think this is simple? This is the most frequently asked questions for anybody who saw the CMS webinar the other day. Knows exactly what I'm talking about, because it was asked probably about 15 different times. And this is one of the more confusing things for veteran assisters who would think this is not the answer, which is coverage starts the first of the month after plan selection. And there are many different versions of this question to make that even more confusing, but the answer, as we understand it, is really quite basic. So this means, if you apply, say, February 16th to February 28th, your coverage will start March 1st. If you apply, March 17th, your coverage will start April 1st. And then, of course, if you apply the first half of the month, it will also start the first of the following month. This is throwing assisters and other agencies for a loop, because this is not how things normally work. Unless you're losing coverage, typically, your coverage will start, if you apply after the 15th, the first day of the following month. So this is new. This is different. I had my doubts when I was first hearing this, as did many others. CMS really doubled and tripled and quadrupled down on this the other day. So I'm inclined to believe it. And in terms of, technically, practically, can this work? Yes, basically by designing the special enrollment period, the way that they would design the losing coverage at the end of the month special enrollment period, this can work without much maintenance to the site. So yeah, this looks really good. Anytime you help somebody, it'll begin the first of the following month.
Thank you. And I should say, because I know we have a range of assistants on the call, if you hear us talking about CMS, that's the National Centers for Medicare and Medicaid Services.
Yeah, for sure. And any new assisters, there aren't any stupid questions, honestly. If this is your first full year, or you finished your exam in the middle of open enrollment and didn't really get to to grease your wheels yet, but by all means, chime in with any question you have because I'm happy to answer it.
Okay, so let's think about those consumers that we already helped last open enrollment and they have a marketplace plan. So can a consumer who already has a marketplace plan switch plans during this reopening?
Yes, this is another interesting one because not only will consumers be able to switch plans, they can actually, so you can switch without restriction. So if you already have a marketplace plan, you can change plans within your same health plan, within your same insurance carrier, and you can even change meta levels during this special enrollment period. Which is a change, which is unusual. Where normally if you had a silver plan, you'd have to stay with silver. If you'd sign up for bronze, you'd have to do with bronze. Right now, people will have the opportunity to change to whatever tier they need based on, if their financial situation has changed, if their network, providers isn't working out for them, they need to switch. Basically, people have, unparalleled freedom more than they've ever had before to switch amongst the different health plans. There are some potential complications that one we'll talk about later, but it also came up, can people switch multiple times during this special enrollment period? And yes, there's nothing stopping them from doing that. Although generally speaking, there isn't really a financial incentive. It'll actually hurt people if they decide to switch multiple times. So if you're an assister helping, somebody through this process and if they see some marketing and they just want better insurance, it might be your job to just talk to somebody and explain how their insurance works and why it might be the best one for them, and if they've already paid towards the deductible, which we'll talk about shortly. So yeah, the key takeaway here: you can change plans, you can change insurance carriers, and even metal tiers. So very new and different this time around.
Thank you. And I will say that I do see your questions coming in. So what I'm kind of doing, if I know the topic's about to come up, I'm pausing. And if I know we're not going to talk about it, I'm skipping it and I will ask Adam after he finishes the questions we already have prepared. Okay, so here's a question about that consumer who already had the marketplace plan. What if a consumer already has a marketplace plan and then switches to a different plan? Will they get to carry over the amount they have already paid towards the deductible this year? So their new coverage just started January 1. Maybe they've already had some visits and they've already paid some toward the deductible. Will that carry over if they switch plans?
Sure. Yeah, this is a really good question that I was just alluding to. Generally speaking, no. If somebody switches plans to a new plan, using the special enrollment period, or any special enrollment period during the year, they can expect to be paying a new deductible. However, there are insurance carriers, companies, health plans can choose that if somebody stays with that company, but switches plans, you say you're, with Common Ground and you pick a different Common Ground plan, for example, the carrier, the insurance company may, switch the deductible that you've already paid over to the new one. So if you've already paid $450 on $1,000 deductible, they may carry that over to your new deductible, but they don't have to. Health plans have the discretion to do that. The takeaway for that is I would say talk to your insurance company. Have the consumer talk to the insurance company. If you're assisting somebody, call the insurance company with them and see what's possible. Some companies may already have standing policies in place where this can be done, in which case great for that consumer. In other case, they may respond with beneficial or unique opportunities for that consumer's financial situation, because all the health plans in the marketplace have been encouraged to be as flexible as possible, basically since COVID started, but now as well. So again, a little, this one's the same, but it's always a good idea to talk to the insurance company just as a best practice, just to see what can be done. But you may also find yourself in a situation, again, where you're advising a consumer and say, okay, why do you want to switch? It looks like, maybe somebody's close to hitting their deductible, or they have hit it already. And, they may just have heard some marketing or seen something, online that says they can get a better plan. And you may just need to go over their plan with them again, which is really important. Nobody can be expected to learn all of this in one meeting in open enrollment. So it's just a good idea to reinforce what a consumer has and the benefits they're getting if they're looking at switching plans, so they can make an informed decision.
And Adam, we have two questions still related to this topic. So one of them is, how will we know which insurances are allowing that carryover of that deductible?
So I don't know that there will be anything that says that, just flat out on the marketplace website, that says that that's going to be possible. I guess it's possible that if you look, when you're applying for a plan and you look at the plan documents, that it might say that, but I can't imagine it would, or that there would be any standardized language to say that it would. The main thing is to contact an insurance company, directly. Take that with a grain of salt, even because when you call a different health plan, you'll get that message right away that says, hey, don't take what this person tells you on the phone as gospel. It may not be the truth, but still you could generally trust those calls. But if somebody says yes, it'll carry over, just take notes, make a note of the date of that conversation, make sure you hear it, make sure the consumer hears it, and that your understanding is the same. But generally speaking, if you see language online through the company's website or in a health plan document, reach out to us, let us know, so we can have that information as well, and we can send that to other sisters around the state, so we can all be better informed about what's possible for consumers.
Thanks. And then to reiterate, is it one opportunity to switch during this time period? Or is it like Medicare open enrollment where they can do more than one switch and their last choice of plan that they enroll into is the one that will stick?
So yeah, let me explain that a little bit more. It's a good question. Yes, they can pick multiple plans during this period, and yes, the one that they have, signed up for on May 15th moving forward will be the one that they have from June 1st to the end of the year, barring another big life change that would qualify them for a different special enrollment period. So they can switch multiple times, but keep in mind that unless they pay their first premium each time, that coverage isn't going to effectuate. It's not going to start. So just have consumers be very cautious about doing that. And again, generally, there's no financial incentive to do that. I could probably, think up a weird edge case where that might be to the consumer's advantage, but it would not be the standard. 99.9% of the time, consumers aren't going to want to switch plans multiple times because you get the most bang for your buck by sticking with the same plan. Switching once because you realize, hey, the plan I have, it's not working for me, or I need to go see this different doctor, be at a different hospital, just my finances have changed. Any of those situations that might make somebody, choose a different plan, then that might be a good reason to switch. The only reason I could think of that we might see people who are switching multiple times is if they had a plan, saw some marketing and switched their plan on their own, and then realized it wasn't what they needed and came into an assister to switch again. That's something you could maybe expect to see, but generally speaking, it's not a good idea.
Thanks. I think we can go to the next one.
Okay, cool.
Okay. So getting into some details, will there be any new questions or changes to the Healthcare.gov application to trigger the special enrollment period?
No, all the marketing and everything we've seen from CMS says that it'll trigger for anybody who's submitting a new application or changing an existing application. So if they report a life change, whether they need it or not, they should get on the eligibility notice results that say you qualify for a special enrollment period. So basically, it's functioning the same way that if you lost coverage, it would just trigger you a special enrollment period, apply by the first of the next month, and pay your first premium to have a new plan. So that's good. That's a good thing that we don't need to answer any questions specifically. We don't need to think about anything differently in terms of doing this. People do need to be aware of it because veteran assisters know you'll often be helping somebody report a change during the year, and it'll say, hey, you qualify for a special enrollment period. And we won't even necessarily know why. In some cases, it will be, okay, yes, clearly there's a reason for this. But in some cases, it's just like, here's your special enrollment period. But just know that during this time period, anytime you report a change, anytime you submit an application between February 15th and May 15th, you're going to see that special enrollment period trigger. It's going to say you qualify for a special enrollment period. If it doesn't come up actually on the eligibility notice, I would say let us know. I'd be really curious about that if for whatever reason it didn't trigger. Because anybody who's been having conversations with me the last 2 weeks about this knows that I've had my doubts the whole time about how this can work. I'm currently on board with the yes, everything's going to go off without a hitch. But yeah, if anything is different than what I'm saying today, if we find out anything different later, just reach out to us. You know, we'll provide you with the best available information, the most current information we have. And I'm really curious to see what everybody's experiences are throughout the state on this stuff.
All right, Adam, and you offered, so I just put your contact info in the chat.
Yeah, okay, cool. Yeah.
All right. Is any verification needed to use this special enrollment period?
So again, no. Everything we've seen from CMS says that there will be no verification asked for. That they won't need to provide, loss of coverage. They won't need to provide anything that says they've been affected by COVID. They won't need to, have any other, qualifying life event. I've moved or anything like that. They may see special enrollment periods for existing reasons, like loss of coverage and things like that. And they could see on the eligibility notice that, hey, it's asking for verification. For this special enrollment period, you wouldn't need to provide anything. So if they're asking for something, it may be for a different special enrollment period that triggered. So I wouldn't worry too much about that. But honestly, that's even a little bit unlikely because since last March, since COVID started, the site Healthcare.gov has been asking for less and less verification, fewer and fewer documents to get people in for coverage changes. There are some things that I feel like trigger all the time. Some certainly immigration often triggers no matter what. If somebody had been previously incarcerated, that triggers no matter what. But generally speaking, they should be able to use the special enrollment period without providing proof of anything.
Thank you. So we get this question, we've gotten this question a lot over the summer. Are COVID-19 stimulus checks, so those checks that people have been getting, counted as income on the application?
No, the stimulus checks, all the stimulus checks that have come out haven't been counted as income, generally speaking. I think it's when you start looking at other types of COVID relief, specifically unemployment and things like that, where it gets confusing, where we've seen, COVID relief not count for Badger Care, but yes, count as income for the marketplace. And that's where it gets a little bit confusing. We do have a link on the screen here to talk about income and what's counted for the marketplace. And I know that there is a specific line on there about COVID and stimulus. So, I mean, just if you need to refamiliarize yourself with what's counted, what the rules are, by all means, go to healthcare.gov, that link, and check that out. Or, you can always ask us.
Okay. So at this moment, because that was our last formal question on the slide deck, I'm going to get to some of them that have come through the chat.
We've got one more, actually.
Got ahead of myself. Sorry about that. All right, last one about Cobra. So Cobra, the full explanation of the acronym is down there at the bottom. But basically what it is let's say you have employer-sponsored insurance, you're losing that insurance, say you lost your job. Your employer might say, okay, you can keep this employer-sponsored insurance even though you're about to not be an employee here, but you're going to have to pay more into it. Oftentimes we'll see people can keep it but pay the full premium they were paying before. That's really up to the employer how that's going to look, but that's called Cobra. So oftentimes when people are getting laid off, they might get an offer of Cobra, but it can be really expensive, especially if they were going to have to pay that full premium amount, the full cost of insurance. So people who already elected Cobra and currently have Cobra through their former employer, will they be able to drop Cobra during this special enrollment period to get coverage through the marketplace, similar to our traditional open enrollment period?
So yeah, that's a really good base explanation, Jenny, for people to think about Cobra. The problem with Cobra that this question relates to is that people who've elected Cobra earlier in the year, say they've lost their employer-sponsored coverage and they missed the initial special enrollment period that would go with that, and they just signed up for Cobra and have been paying full price the rest of the year. You can't drop Cobra at any time normally, and elect marketplace coverage after that window until open enrollment. So in this case, what we've been told, this is going to function just like open enrollment, where if somebody has been paying their Cobra, it's really expensive, they can just take advantage of the special enrollment period to drop the Cobra coverage and switch to a marketplace plan, which is great. That is new. That is a change. It looks very much like open enrollment, and it often helps people because people generally, when they are laid off or they're leaving job for any other reasons that they're allowed to take Cobra, they don't know all their options yet. They're presented with the Cobra paperwork. They don't really know marketplace options. They don't really know Medicaid options, and they just go, okay, let's figure out how to pay for this, and they do that. But they'll quickly find that it's very expensive, and they might not be able to maintain that because it could take them a while, especially now, to get back into the workforce. So yes, if somebody has Cobra and they come to you between February 15th and May 15th, and they say, hey, it's too expensive, you could be, hey, good news, we can get you in using the special enrollment period. You could drop the Cobra and pick up a marketplace plan.
Thank you. So I just wanted to note that if you're online here and you don't yet have the chat open, I would encourage you to do so, because I know especially that question related to whether the deductible will carry over for somebody switching plans during this time period. A couple of our qualified health plan representatives have chimed in and kind of explained how if you're staying with their company, then yes, the deductible would carry over.
Yeah, I see that. Good thing I went with that common ground example, huh?
So one of the other questions, Adam, was, I am assuming that claims will not be paid until premium is paid.
Generally speaking, that's true. So let me back up on that just a little bit. So your coverage effectuates after you've paid that first premium. So that means the coverage doesn't start until you've paid that first premium. If somebody is switching plans because they've already got coverage that's ongoing and their premiums are up to date, and they switch to a different plan, the previous plan would still pick up bills until it ends. And then, correct, the new coverage wouldn't pay for any claims until after that premium is paid, which, again, the effectuation, if you don't pay that first premium, the coverage doesn't start. Later in the year, after the first one, if a consumer with tax credits misses a premium, they're in a grace period, and they can pay those back and get their claims paid. But again, you've got to pay all of the back premiums that you missed with 90 days for somebody with APTCs, tax credits, to get their claims paid. But yes, you have to pay that first one for a new plan to start paying your claims.
Thank you. Can someone who is enrolled in a small business group plan cancel with the group plan and enroll during this step with the marketplace?
In theory, this is a situation I hadn't really considered. Generally speaking, yes. If they're with a small business plan, they would want to make sure that they understand all of the particulars about that small business plan. Make sure they're talking to their employer, make sure they're talking to their agent or representative that negotiated that, make sure that they know all the risks of doing that. So if a consumer comes to you and says, hey, I'm on this through my small business, I'd like to see if I can get into the marketplace because this coverage isn't good for me. You'd still want to test things like affordability. If that's affordable coverage that was offered through the small business exchange and it was offered to them and they had taken it, it might be that they need to stick with that because they wouldn't get tax credits. So it's one of those things that I would do, gather as much information as possible before somebody does that. It's not a situation we see super often because of, SHOP, Small Business Health Insurance Options program has just been it hasn't received a lot of support. It's mostly switched over to agents and brokers completely. So navigators and CACs tend to not encounter very often. So again, I would just do all of your information gathering, your homework to figure out what are the particulars of that plan, make sure it's minimum essential coverage and all of that. Make sure the consumer makes an informed decision before dropping any insurance, not just small business insurance, before dropping an insurance and switching to the marketplace.
Thank you. And I should kind of step back a little going back to our intro of Covering Wisconsin. So at Covering Wisconsin, we are the one navigator entity in Wisconsin, which means that we get federal funding through CMS to do navigation, to enroll people in the marketplace. A lot of you might be from what we would call CAC's organization, which is Certified Application Counselors. What we know is that as navigators, we are contracted to do this enrollment work throughout the year, but some of our CAC organizations, maybe you bring on extra people or you assign them to applications during open enrollment and you weren't preparing for this 3 months of reopening. And so maybe your CACs are assigned to other projects during this part of the year. Please know that at Covering Wisconsin, we can always take referrals from our other partners as well. So for one, if you don't quite have the capacity and you're getting more volume than you were expecting, we're doing all of our appointments over the phone right now. And I'll make sure to put that info in the chat near the end of how people can connect with us. But the other thing is, Adam, especially, he's in so many meetings with our project officer at CMS, with other navigator entities around the country, trying to stay up to speed on all this policy. So if you feel like you're encountering a consumer and you just aren't quite confident moving forward, that's something too where you can reach out to us with those complex cases and we'll help work through them.
Yeah, that's absolutely true. Part of our role as the navigator organization is to provide, complex case assistance. And there isn't really a clear measure on, this crosses the threshold for a complex case. So if you're, struggling or you need an answer, just reach out to us. A lot of the experienced CACs and navigators are on our navigator listserv, which we use to kind of, workshop different questions, obviously without providing any specific case details, but just generally the different situations. So anybody covering Wisconsin has seen a lot of different situations, and yes, we're happy and sometimes even excited to workshop difficult cases we've never seen before.
Adam, another question: are consumers able to switch their dental plan during this enrollment?
That's a good question. One that I hadn't seen asked during the big CMS webinar. Yeah, in theory, yeah, they would be able to. Yeah, because I mean, the same basic rules qualify for dental, and typically, I mean, you can actually, switch your dental or sign up for dental anytime during the year if you have a health plan through the marketplace. So yeah, there would be nothing stopping someone from doing that. Again, just keep in mind. Dental plan, you got a deductible for that as well. Your dental plan, typically, so especially if it's a new one, if you've been with a dental plan through the marketplace for a while, you're not going to have this necessarily. But for anybody switching to a new dental plan in the marketplace, there's almost certainly a 6-month waiting period before you can get major services done. So again, you want to question the reason for doing that. A reason to do that, I'm just kind of speculating off the top of my head. If you maxed out your dental plan right away and you said, hey, I'm going to need more services before the end of the year, there could be a reason to do that, where you go, okay, I'll wait the 6 months and then use this new dental plan. So there may be a reason to do that, but it's certainly not something that should just be done, on the fly because somebody can. It's something I tend to have, really involved dental discussions with my consumers because there's kind of a sweet spot for whether or not you should take dental coverage. They want to know exactly how much is going to come out of pocket, or which dental providers take that insurance. So like healthcare, don't do anything lightly. Really look and see, do I want to do this? But yes, I don't think there'd be anything stopping you from doing that.
Thanks. What is meant by direct enrollment channels when signing up for the marketplace?
I haven't heard that that particular wording before, so maybe they could provide more context. I can certainly speculate. If you're talking about direct enrollment channels, direct enrollment typically means enrolling with a health plan directly from that particular insurance company, that particular carrier. So you can do direct enrollment that way. Typically, anytime you are working, that could refer to off marketplace. So if you're applying for coverage off of the exchange, so not on Healthcare.gov, directly from the insurance company. that could be what that's referring to. Again, I'd love more context, but just remember, if something is off marketplace, it still has to follow all of the ACA rules, even if, say tax credits aren't offered, because, any plan by law that's offered on the marketplace, they have to offer off of the marketplace, but they're governed by the same, Affordable Care Act law. So there wouldn't be much difference there other than signing up directly with the plan. So that's what I would guess that to mean, but if that's different, I would like to know.
Yeah, so it came up, it was mentioned that it came up in a webinar, and then someone had said that it was when you use a provider like Health Sherpa. So could you explain Health Sherpa a little bit?
Yeah, no, that's I would call that bad nomenclature. I would consider that indirect, but it's a Health Sherpa it's a site, it's a website. It's the most simple way to think about this. You got a website that plugs directly into the different health plan options that are available through Healthcare.gov. Typically, agents and brokers tend to use these a little bit more. Some other organizations might subcontract to use them. But it's going to give you the same options. It might streamline the process a little bit. It might make things a little bit faster and more efficient for somebody, an assister who's helping with this. But if that's, the original question is what is meant by, so that would be a Health Sherpa situation. But there wouldn't be any fundamental difference to the consumer, who's being helped.
Thanks. So a couple just clarifying questions to the topics. If someone signs up for a plan at the end of the month, will their coverage start on the 1st if they haven't paid their first premium, or will they have a certain amount of time to pay?
Yeah, great question. Yeah, typically the coverage isn't going to effectuate if they don't pay that first premium. So, certain amount of time to pay. Because the special enrollment period is so generous that they'll have, time to pay it, but typically the coverage wouldn't effectuate until the date that it's paid. And in some cases, because the special enrollment period is so wide open, they would have until, the next month to be able to start that coverage. But you'd miss that month potentially. You could have a gap if you do it that way. So be very careful at the end of a month, if you are going to sign a consumer up, February 28th, make sure that they pay that premium. Make sure, whether it's, calling the company online to submit that payment, or, submitting it through the website. Make sure that, you've taken screenshots if you're looking for a confirmation, receipt, or the confirmation email goes to the consumer, so they have that record, so they can say, no, look, I have paid my premium. It's possible that different health plans, again, they could have the discretion to work with the consumer to apply the rule a little bit differently, to say, okay, it looks like, you applied and we did receive your payment. Yes, you'll be fine. We'll cover everything going back to the first. But that can cause problems. So again, if you're helping somebody at the end of a month, make sure that they pay that premium just as soon as possible. Whether it's do it online, over the phone, or get that check, dated right away. Again, there's some discretion that the health plans have, but it's something that I typically, you want to make sure consumers are aware of the risk. And yes, there's definitely reasons to do that, to sign up on the 28th and start right away on March 1st. This works really, this works if you're losing coverage typically throughout the year. So it should work now, but this is a little bit of uncharted territory. I don't know, I know we've got some health plan representatives in the chat, which is fantastic. I don't know if any of them have been struggling to set up the infrastructure for this a little bit, or to comply with the CMS guidelines, because this is a little bit different. So yeah, in theory, the main guidance there is make sure people pay that first premium before they start getting care. That's number one. But it could be a little bit trickier. That's the way it's supposed to work. I don't know if any health plans have been struggling with CMS guidelines at all.
Thanks. We have a few more questions, and Adam, if we try to answer them real quickly, that'll give Stephanie some.
Okay, I'll do what I can.
Okay, thank you. If they drop Cobra coverage and enroll into the marketplace, are they possibly eligible for subsidy?
Yeah, of course, yes. If their income's right, then yes.
And just to clarify, if the patient did not choose a dental plan along with the health plan at the time of open enrollment, that he or she is able to sign up for dental anytime during the year.
Yes, that's the way it has worked. Again, oftentimes not a great idea with that 6-month waiting period. It could be a losing proposition unless somebody's playing the long game. But yes, that is possible if somebody has a health plan.
And thanks to the people in the chat who are kind of clarifying that direct enrollment channels a little more. We appreciate it.
Oh, great. Awesome.
Okay, so this is a two-part question, and this has to do with Medicaid continuous eligibility. So if people recall, Badger Care Plus right now, if people are signing up for Badger Care Plus due to the public health emergency, once they are enrolled in Badger Care Plus, they have continuous eligibility. They are not losing that coverage during the entirety of the public health emergency. And right now that is expected to go at least through this calendar year, so at least for 2021. So given that, we know that people who anytime from, I think it was March 18th or somewhere around that date was when this continuous eligibility started. Anybody who signed up and got on Badger Care has not been kicked off of coverage this whole time. They can still report their changes, report changes in income, but unless they moved out of state or something like that, that would make them completely not eligible anymore for Badger Care Plus, they still have Badger Care Plus. Knowing that, with Medicaid not being confirmed closed or automatically extended due to COVID-19 public health emergency, will individuals be able to obtain health insurance through the marketplace, or will they be denied due to having current access to Medicaid?
Interesting question there. If somebody is in that continuous eligibility, that they should, stick with Medicaid. There wouldn't be a reason to apply on the marketplace. The rules for the marketplace say if you're eligible for affordable coverage or Medicaid, you would take that before getting a subsidy, getting a tax credit. That said, there's been some guidance that that if people have been duly enrolled, that they won't be asked to pay back excess tax credits. I wouldn't necessarily attempt to do that on purpose. So I would suggest staying with Medicaid. If it rises to that where it's becoming a constant question or a really specific complex case, contact Covering Wisconsin. I'd like to have more details about why somebody would be thinking of doing that, because I can think of reasons too, but not lightly.
Okay, and then the second part of that question is, so when Medicaid rules change and that public health emergency would be over, is that a life-changing event where the individual can then enroll if the marketplace open enrollment period is closed?
Yes. Yeah. Short answer, yes, absolutely. Slightly longer answer, we're expecting that to be early 2022. So we should see that if they still do a rolling basis, it'll be rolling as of March or April 2022. So we won't see that for a while, but yes, that's definitely a life event.
Okay, thank you. And then somebody shared with me in the chat a link to the IRS frequently asked questions regarding dual coverage. I haven't vetted this source, but I will just copy and paste it.
It's good. It's good. Yeah, I've seen it.
And so, Adam, that concludes the questions that I've seen right now. But, I don't know if I missed this, but if they enroll before or on the 15th, they would be eligible the following month.
Right. And that's normal. That's normal anyway. So, yeah.
Mm-hmm.
I'll do this slide really quickly so I can hand it over to Stephanie. If there's time at the end for more questions, we'll definitely take those, and we'll track them anyway. I know which Jenny will take them down. So the budget reconciliation, basically COVID relief happening at the federal level, what's being discussed. The Ways and Means have proposed a few different things. We don't know if these will materialize as policy or modifications to the existing law regulations, but what's been proposed has been expanding tax credits for 2021 and 2022, so making coverage more affordable for people who qualify for tax credits. It's also been proposed, this wasn't in the Ways and Means document, but expanding tax credits above 400% FBL, limiting the repayment of excess tax credits for 2020, which seems to jive with what we're seeing from the IRS anyway, and then subsidizing Cobra payments potentially for employers who can't make payments for their employees, while they're on Cobra, which that's often how it goes. So those are being proposed, those are being discussed. They've been discussed Wednesday through today. Nothing to count on or bet on yet. Obviously, everything that has to go through the legislative process takes time and is subject to revision. So I would just kind of keep that in the back of your mind and not worry too much about it yet. Thanks, everybody. Stephanie?
Yeah, so I'm just going to talk a little bit about where you can find outreach materials, and then briefly tell you what we've seen come out so far about who's still uninsured, so you can have a better idea about who to target. So first of all, we will have a national campaign. CMS will have one. They say it's going to be available on the website on Monday, the 15th. So their plan is to focus on paid TV, digital ads, earned media, and then direct to consumer emails and text messaging. And it's my understanding that they're going to be sending these to consumers who have tried to enroll and maybe they didn't finish their application or had some type of barrier. So that's going to be rolling out expected Monday. And here's the web link of where they're going to be posting it. Another group, a national group who has already posted a toolkit with resources for this period is the Young Invincibles. And right there you have their toolkit. Supposedly CMS said that you'll be able to somewhat alter their promotional materials to make them more applicable for your area. And if you could advance to the next slide, Adam. But we do have materials that are specific to Wisconsin. So first of all, we have a toolkit by OCI. If you're not familiar with them, that's the Wisconsin Office of Commissioner of Insurance. And that's the website there. They have right now their toolkit from OE, and some of the ads there are still applicable for this new enrollment period. What's really beneficial about their website is they have 3 languages. And so because they have 3 languages, they're currently they have materials ready to go. They're being translated, and they should be uploaded on that toolkit next week, hopefully Monday, if not sooner. So those are anticipated. They're coming soon. Covering Wisconsin also has a toolkit, and we have both English and Spanish. On our toolkit, we have social media posts, outreach cards, flyers, and videos. Now, because this is more of a marathon as opposed to the sprint of open enrollment, we're going to be posting new messages every month. Our goal is a new message every week. Hopefully we can meet that. If not, there'll be 2 to 4 new messages every month. And part of what we're thinking is, as we're identifying new audiences we want to target, or if we find out from the Ways and Means Committee, or we're certain about certain policy that's going to be adopted that could very greatly affect eligibility for tax credits, we will definitely come out with new messaging targeting that. So in addition, on the toolkit website, we have promotions also about Badger Care Plus, public charge, and the new texting tool that helps you it can be used directly with consumers who are immigrants and may be concerned about taking any type of public benefits or health insurance because of fear of public charge determination. So one of the best ways in this current crisis to reach people may be social media, as a lot of us may not be going out as much, or maybe your offices are closed. So we recommend that you follow any one of these Facebook pages. And also, I'm not sure about MChem, but I know that both OCI and Covering Wisconsin, we also have Twitter accounts that we regularly post to. Following can help you remember to post new posts, because you can just repost what someone else posts. And it also helps make more content more viral. So, and if you could go to the next page. So I wanted to give you a little bit of an idea of who is still uninsured. Now, this data comes from the Kaiser Family Foundation, and I have the link to the report there at the bottom. So they thought it'd be really interesting to identify who could qualify for a $0 bronze plan, because there really should be no reason that you wouldn't sign up if you're uninsured and you could qualify for something that doesn't cost you anything every month. So they found that 62% had a high school education or less, 39% were young adults, 49% are working part-time or unemployed, 34% have a non-English speaker at home, and of those 34%, 79 of them are Spanish speaking, 32% are Hispanic, 25% work in the arts, entertainment, or service industry, 19% live in rural areas, and 14% work in construction, and then there's a 14% that lack internet. And if you could go to the next page. So another report that was really interesting is looking at what are the barriers to enrollment if you're uninsured. And this is from the Urban Institute. Again, that link to that article is below. And they found that 65% of the people who are uninsured have either heard nothing about Marketplace or little about it, and may have no idea that financial help is available. I thought that was a pretty high number. It means we have work to do, right? Nearly 50% who have heard about Marketplace just assume it'll cost too much. So we have a lot to do with the assumptions, a lot of work there. And then only 29% have tried to apply for Medicaid. And of those who didn't try to apply, most people assume they will not qualify. So we have a lot to do with the barriers and assumptions that are in our community. Now, we know that the main way that people learn is word of mouth. So we can't encourage enough when you're working with people, encourage them to spread the word to friends and family. So it's going to be the number one way to reach people, and also get out materials into the community. Oh, I have one other thing to say. Our resources in Spanish, we hope to have up later today. We're still waiting on some translations. So if not, they'll be up on Monday.
Stephanie, just broadly, what do you think about the Marketplace calling this special enrollment period? Does that mean anything to consumers?
Yeah, I didn't go into that.
I gotta know.
Yeah, I don't think most people understand what a special enrollment period is. Anyway, I don't know that people understand what it means when you say open enrollment. I know that in our marketing materials, we've avoided that. We said, it's open again. We list the dates. I know that CMS is not going to say that in their marketing materials, probably for some policy legal reasons, but we don't think that that's going to have a lot of meaning to people.
Right. Yeah, so I just want people, there's going to be a lot of different messaging. There's obviously a lot of different toolkits to draw on, and we want to be consistent. But really, it is going to be more of a marathon. Federal messaging starts on Monday, so we'll see how this goes. Yeah.
I'm a little worried that they're putting a lot of their eggs in the basket of just traditional marketing. So I think they'll have materials available for community CACs and navigators to use. But we know that when something is marketed for a national audience, it may not be very useful or meaningful for what's happening on the ground locally. So,
right.
I will say that for whoever's on the call, if you need materials and you have a particular message that you think would be really, really impactful to your audiences, let us know. We're happy. If it's going to be impactful to your audiences, likely it's going to be impactful to other groups as well. And so we're happy to try to develop something.
Thank you. So what I'll do, I do have a couple specific questions that we'll get to you, Adam, in just a moment, but I've been cutting and pasting a lot in the chat, so thank you for bearing with us as you get a lot of links coming through, but I am getting direct messages asking for things, so I thought it was valuable to put those in. To contact Covering Wisconsin, I'm going to put that info in the chat right now. So if it's a consumer and they want an appointment because you're not able to help them or you're not an organization that does appointments, we do have what's called our connector tool, our health insurance enrollment connector tool, where they can actually schedule an appointment online. So it's not just our organization, it's other organizations as well who maybe have put appointment time slots. So you start by your zip code. You will see that for the phone numbers, I'm going to list our Madison and our Milwaukee phone number. Although those are where we are most located staff-wise, we are a statewide organization. And so just because you're going to see the Madison and Milwaukee phone numbers doesn't mean if you're in a different part, you can't contact us or send a consumer our way. We do serve the entire state. And then with that, a couple things, this is our very last slide, but just if you have additional questions, by all means, you can still type those in. I know we're coming up on time in 5 minutes. So out of respect of time, if you need to fall off at 10, you can. Those of us who are presenting, we will hang on the line for a few minutes afterward, just because we know this is coming up and we want people to feel like they can get their questions answered today. And then also, if there are any new or significant changes, so if things with the premium tax credits are changing, any of those major details, we'll either be sharing info through our email lists. I am going to add people on this call to our email list. If you can always unsubscribe, but by default, we'll add you on since you attended today. And then also, if it's needed, we will do an additional training. So especially if a lot of you contact us and you have the same question over and over, that tells us we need an additional training. Okay?
Or we have some suddenly very large policy changes coming out of what's being discussed.
Yeah, we'll let you know.
Yeah. And also, if you're looking to reach Stephanie for something with outreach and promotions, those Madison and Milwaukee phone numbers, that's our staff that answer. And so you can just let them know why you're calling and they'll help direct you to the right person.
I can also type my email in the chat.
Thank you. So Adam, going back to 2 specific questions, I'm just going to read those questions if you don't mind answering them in the last few minutes.
Sure.
Okay. So one of them was, and I should say in case if you are one of the people that needs to fall off, thank you very much for being here today. We appreciate it. But the question was, I have a client that has had marketplace coverage and lost his job. He enrolled in Badger Care in December and the marketplace did not end, even though he had selected to allow marketplace to automatically close if consumer is found to have Medicaid. So it sounds like he's been dual enrolled, right? Will he be penalized when he files taxes?
Really good question. Honestly, I saw that one too, and I was thinking about it a little bit. The time frame on that is interesting to me, but you could reach out to us directly for more details. But basically, that button on, I allow the marketplace to end my coverage if I'm found eligible for other coverage. I'm always very skeptical of it. I don't think it works well. So by all means, click that because it's part of the submission process of the application. But just be aware you want to also couple that with a message of, to a consumer, hey, if something is changing, get back in touch with me. Make sure that you log into the marketplace if you're more computer savvy. To the more specific question, based on some of the guidance, both through the IRS and what's being discussed by Ways and Means, they very likely won't have to. That's the short answers. They more than likely won't have to. If none of the rules were changing, none of the policies were changing, it's possible they wouldn't have to, just in general, based on how the tax filing process works, or if you really needed to get nitty-gritty into an appeal. So they should be okay, is my answer to that. But if you have further questions, contact us directly and we can help walk you through it.
Thanks. And then the question was, will there be more information released for people who were dual enrolled for Medicaid and Marketplace and have to pay back a premium tax credit? So I think the first part is it's not clear if they'd have to pay that back. And also that more information piece, especially as the longer that it goes that people have had continuous Badger Care eligibility, maybe they didn't even know they have continuous Badger Care eligibility. How does that go?
So Dee just did a nice stakeholder call addressing this topic on Wednesday. So there is that, I think it was that exact IRS link. Take a look at that. So the short answer, it looks like people, will be fine if they were dually enrolled. I don't know how closely they're going to look into the circumstances of whether or not somebody had the opportunity to switch, or if they're just going to, blanket look at all of 2020, which is probably what they would do, I imagine. Will there be more information? I don't know. I would expect 2 things. One, any information produced by the IRS will not be consumer friendly. just right off the bat. It won't be, but and they may not get to it at all because they are really backed up and have been for about a year. Healthcare.gov, they may have decent messaging about it, but it's probably not going to get to consumers. So anything that comes out about this in more detail, I think we're going to have to do something about it. Honestly, it sounds like that this is enough of a question and there'll be enough confusion because it's, tax time now, that we'll want to provide you guys with more information. So let me talk to Stephanie and Jenny about, putting that in one of our listserv messages, something like that, or just doing a short recorded session on it or something, just because there's definitely some things there to clarify.
And with that, I think that concludes our questions. I know there was some insight about certain things. I've gotten some messages about when coverage starts, how to pay premiums, things like that. So thank you for those who have shared. You're welcome to still hang on the line and communicate with us via the chat if you'd like. But otherwise, I'm going to end the recording and just that concludes our session for today.
All right, thanks, everybody.